Hello, everybody. Thank you, Dr. Farah. My name is Karen Negedu, and I'm going to be talking about collaborative healthcare with cosmetology. Like she said, my faculty mentor is Dr. Ferris, and my honors mentor is Dr. Marshall. So we're going to start. So healthcare in the salon, the reason this topic stands out for me is because we want to be able to prepare stylists and so many other people, professionals, that's what we're going to call them, so that they can be able to identify certain diseases and be able to refer clients to the right people. So they're the frontline defense for us. Before people get to, a lot of people don't have healthcare and a lot of people don't get to meet their physicians or healthcare providers. That's why we need to be out there teaching people what to identify and how to care for their clients properly. So I'm going to be talking about cancerous moles, leg and foot care, and fingernail care. So how it all began. Last summer was my first pedicure. I don't like people touching my feet, but so so my cousin told me, she was like, Karen, let's go. She wanted to do something fun. So we left and we went to Ravenscroft Beauty School. And I'm very frugal. I don't like spending money on things I can do myself. So we went there and they started massaging my feet and my calves. And I was like, okay. So as a nursing student, everything, or healthcare student, anything someone does for you, you think of every disease or any potential complication you can get from that. And so I was thinking, oh, she's going to give me a PE or a stroke or something like that. So then I started talking to her and I asked her questions. I was like, so do you guys get education about certain diseases or things you guys see here? And she was like, not really. They do get education about what to watch out for, infection control and things like that, but they don't get in-depth, they don't get an in-depth education about what they see. So that's where this project began. So I started this project, I gathered information because there was a gap in the knowledge there. So they didn't have enough information. And so I decided to choose two beauty schools in Fort Wayne, Rude's Beauty School and Ravenscroft. They're like on opposite ends of the town. And so then we began talking. I went and I talked about so those schools, they help them get their license that way. So it's like they're a university, but for cosmetology students. So they get their license and they're able to practice anywhere. So they can practice in Cali salon, they can practice every day, they can end up teaching whatever they want to do. And so I thought that was important because they're a prime group, because they get to teach their other classmates, or they get to teach the people wherever they go to work, things to identify. They have more knowledge that they can share with each other. And so, the lesson was on foot care, and I expanded it. So the topic or the lesson I'm going to give today, it's a shortened version of what I gave to them. And so, and then afterwards, they talked about how they wanted to know more. So after our whole lecture, they wanted to know more about moles they find in the hair and things like that. So we decided to carry on. For me, identification or early identification is key to preventing something worse. So when I first started, I don't know if you guys can see it, I had a pre-test for them. We used something called Socrative. So it's like clicker, eye clicker in class. And I asked them questions, just basic questions to kind of see how they feel about infections and what they should do. Now, if I were to ask you a question right now, if you see your leg is warm, it's swelling, and it hurts, would you massage that part of your feet? You would, right? A lot of people would say yes, but no, you shouldn't. So things like that. I wanted to ask them questions like that to see how they feel or what type of knowledge they have in regards to taking care of clients that they see. So then I started on foot care. Sorry, the images, they're kind of very gross, but bear with me. So I started on foot care, and I talked about these 4 things. I did expand and I talked about infections and other things I carried on, but I'll explain. So deep vein thrombosis, or clots, a lot of people call them clots. When I asked you about the warmth in the leg, and you guys said yes, this is what I was talking about. So most people, they'll have clots in their leg, and it will appear as warm, red, And if you touch it, you can feel it. And but then there's a difference between each foot, like each leg. There, you know, one is different from the other. And so and I asked them, I was like, you do not massage things like that. You want them to go to their doctor, because if this is dislodged, like I explained, or I will explain, I explained to the students like a pipe. If you have a wad of like tissue in the pipe and you kind of break it down, it breaks apart and travels to different parts of the pipe, right? And so that's like your blood vessel. So if you break it apart, it's going to travel to different parts of your body. It could travel to your heart, your lungs. It could also travel to your brain. Then you have a stroke, you have a PE, or pulmonary embolism, and all those things are deadly. So you want to make sure that my aim for this was to make sure they understood how to identify it and how to refer clients to the right people. So the next thing we talked about was diabetic neuropathy. So with diabetic patients, when you have too much sugar in your blood vessels, you end up it wears down, it wears and tears on your nerves and your blood vessels. And so this is why I wanted them to know about this, because some of the patients, not patients, clients, in their feet, they can't feel anything. It reduces their sensation, it reduces their ability to feel, touch, temperature, and things like that. And let's say you put your feet in warm water and you can't feel it, or you put it in hot water or cold water, they can't feel it. So you want to make sure that they're touching with their fingers, making sure they're testing it to see if it's the right temperature. Now, also diabetics, they are prone to getting infections. So you want to make sure that you're sterilizing your equipment and all that. And I'll give a story. My professor told me, she said she had a client once, or a patient once, that came in and he didn't have, he saw oozing in his feet and he didn't know what was going on. And they wanted to check, and a nail was stuck in his feet. And that's because of that diabetic neuropathy. They can't feel pain, touch, sensation, anything like that. They can't. So you want to make sure that when you're trimming, you're cutting, or doing anything with people that have diabetes or neuropathy, you want to make sure that you're careful, because they won't be able to tell, and then you have exposed somebody to something else. Now, the next thing was peripheral vascular disease. This goes hand in hand with chronic venous insufficiency. So your arteries take blood away from the heart, and the veins take blood towards the heart. The arteries, for instance, when you have clots or you have problems and you're not able to get, or plaques or cholesterol build up in your arteries, and you're not able to get blood down to your leg. So that's when you start getting this peripheral vascular disease. And now with that, when you don't, let me explain this better. But when blood carries oxygen throughout your body, and that's what keeps your blood and your tissues healthy. So your fingers looks pink, nice, warm, because there's blood and oxygen going to that part of your body. So now if you tie off a part of your body, or like your finger, for instance, it turns purple or turns black. And that's because you no longer have oxygen going to that part of the body. Now think about this person that has had no blood flow or oxygen to one part of his leg or her leg. So after a while, it dies. And so with people like this, you want to refer them to their podiatrist. You don't want to be the one touching it or giving them an infection or passing on something. Let them go meet their podiatrist. So like I said, to repeat, the aim is to make sure people know what to refer and who to refer to the right person, to the podiatrist, to their physician, their healthcare provider. And chronic venous insufficiencies, the blood is not going back. It's not sufficient, like your body is not pumping it sufficiently back to the heart. And so you get pooling, you get varicose veins. And with these people can get ulcers. So just think of a tight balloon that just stays in there. And, you know, anything can cause you to bleed or, you know, open ulcers. And like I said, infection is a big deal. You want to make sure that these people, when you're washing their leg, you point those things out for them. You tell them, you know what, you have this big ulcer here, so you want to make sure you're caring for yourself. And sometimes it itches them. So you want to make sure you're not itching the client's feet. Now, another thing is we did a post survey right after the presentation I had with the student. We did a post survey to see how they got the information and how they were going to utilize it. And so the only reason that's lower is because some people didn't answer. But it was better. They got to understand better. They knew what they were saying and all that. And so apart from that, they did add that they wanted more information. So things on like skin moles, and they wanted more information on things they find in the nails, because they say they get clients all the time that they just can't tell what's going on, and then the students call their instructors and they come out there and they also do not have them. So I decided to increase my project, and that was where my honors project started. I wanted it to be not just about the feet, but I wanted to do something on skin cancer identification, things you should watch out for, what are the signs, symptoms, and also fingernail care, just brief things that they should know. So I went online according to the American Cancer Society, I found in Indiana, this is in Indiana, there were 35,280 cases of skin cancer, and then there were 13,690 deaths in Indiana. So just things like this it kind of increased my drive to do a project like this. So now on to skin cancer. There are 5 specific types I wanted them to look at or be aware of. So the first one is the solar keratosis. And this is just like a rough, scaly patch on your body. And you can see it anywhere you're exposed to sunlight. That's where you see it. And so is the basal cell and the squamous cell carcinoma. Now, for the squamous cell, it's a dome-shaped. And one thing you see, it's shiny, it's pearly. So that's one thing you'll use to recognize the difference. Now, the squamous cell, it can be rough, but it's a bump also. It's usually flat at first, but then it starts to grow. And take note of what I'm saying, the growing, and it looks rough and things like that. Now, melanomas, it could start like a freckle, then it starts to move, so it's moving. And then the Merkel cell carcinoma is the new one, and this also has this irregular shape that it might look like a little mole somewhere, then it's moving and spreading. But one of the things I wanted the students to understand with identifying it is the ABCDE of melanomas. So the first thing to do is the asymmetry. If you see something starts, if you put a line in between a mole and it's not symmetrical on both sides, you want to let your doctor know, or your physician or your healthcare provider, whoever you go to talk to about healthcare problems, you want them to know. Then if the border is not smooth all around, so benign or non-cancerous moles, they're smooth all around. Like if you see, most people have moles on their body and it's smooth and it's round, it's just perfect as it is. But then for cancerous moles, they're not smooth, they're rough, and they're different. The next thing is color. So sometimes you see a mole that has not just black or one color, it has different colors in it. It could be purple and black, it could be blue and black. So you want to take note of things like that. Then the next thing is the diameter. So if it's greater than, there's a pencil there to kind of give you a reference, so 6 millimeters. If it's greater than that, you want to take note of that and let your provider know as well. And evolving is the new one, E. So if it starts somewhere and it keeps moving, like I said, if it's growing or if it's progressing, you want to make sure you're taking note of things like that. Now, my advice to the students is that they should take note, because they see a lot of clients, people that do their hair or make their hair or go get their nails done or things like that. They do it sometimes on a frequent basis. They go there, they have regular customers. If you see something happening this week and it's changing the next week, you want to draw their attention to it. I want the students to be able to take pictures or ask them to take pictures and show them, so that way they can observe those changes in their body. Apart from this, there's some other types of identification that you can help. A lot of people, they'll see this and they're like, oh, I have moles on my body that looks weird and all that. But then you also want to look at, there's something called the ugly duckling sign, where we have, if you look at the moles on your body, there's a symmetry to it, in the sense that mole A, B, and C, they all look alike throughout your body. But then there's mole D that's different, and it's changing, it's evolving, the color is different, the border is different, something like that. That's that mole, that's the ugly duckling you want to tackle. You want to make sure your provider knows about it. So then I'm moving on to nail care. So nail disorders can arise at any age, and about half of all nail disorders are of infectious origins. 15% are 15% are due to inflammatory or metabolic conditions. So when I was looking at this or reading about this and doing some research about it, a lot of metabolic diseases or diseases with like a person has can cause changes in your nails. And so I just wanted them to know, or want the students to know, about what you should observe, or if you do observe it, what you should do. You should make sure you draw their attention to it. And so things like this ram nails, for instance, and that's sometimes caused by poor blood flow to the body or to the legs or the toes. You want to make sure you don't cut that yourself, because you don't know. I mean, it's not even pretty. Just send it to the right person. And so they're called ram horns, and this can be because older people tend to get this because they wear shoes. They can't even feel their legs and things like that. So you send them to the podiatrist. If they have nail fungus, a yellowing of the nails, and it becomes brittle, so you want to also send that person to the doctor so they can put them on the right medication or care for it. If they have yellow nails, you know that this is not just because their nails are yellow in color, but it's something else that's causing it, some other disorder in the body. Now, viruses and tumors, this black sign across the finger is one of the signs of a tumor occurring. From what I read, tumors will not directly come on your fingernails. It starts from the bottom and rises, and then you see the sign on your fingernails. So if you're already seeing this sign, that means you really need to go talk to a doctor, because, or your healthcare provider, because it's not just, it's kind of like an iceberg. It's a bigger thing going on beneath it. With viruses, this is where I wanted to emphasize the care and the cleaning and sterilization of their equipment. We want to make sure that this cosmetologists know that when they're sharing equipment with people, they want to make sure that they're cleaning it, disinfecting it, and making sure that the next person is not catching something that someone else is bringing. Now, clubbing, that's also another sign that you're not getting enough oxygen throughout your body. And so you'll see people like that. And peroncai, that's also a bacterial inflammation that you see on the hand. You don't want to pop it yourself. I know it might look interesting to do that, but we don't want people doing that. We want you to send the person to the right or refer the individual to the healthcare provider. So general care instructions I want the students to know, or some of the aim of my project. I want them to know their ABCs and be able to remember it. So if they see something that's not symmetrical, or the border is changing, or the color looks weird, or the diameter is bigger than normal, or it's evolving. So from the last time they saw the person, it has changed and it's moving or spreading. You want to make sure that they know how to report it to the client so they can be referred to the right person. Another thing is, do not massage anything suspicious, even if, because people will come if they have pain in their leg, they'll ask you, please, can you massage that for me? You know, this little old lady is like, oh, this hurts so much. Don't do that. You know, tell her to go meet her doctor. If there's something that scares you or worries you, we want the person going to the right place. And we also want them to be able to, or be comfortable enough to ask questions, whereby they're asking, are you diabetic? Are you on blood thinners? Are you on anything? Or is there something causing a change in your skin? Or is there something you want me to be aware of? So you don't cause, or you protect the client as well as protecting yourself. And we want people to be able to, or be comfortable enough to refer people to the right healthcare provider. Another thing is, according to CDC, diabetes is on a growing trend in Fort Wayne, in Allen County. So we also want people to be aware of those diseases. So like I told you earlier, with diabetes, when there are a lot of sugar in your blood vessels or around your blood vessels, you cause wear and tear. And so when there's wear and tear elsewhere, you also want to make sure you're protecting yourself if the person has neuropathy or things like that, protecting your patient and your client. And poor hygiene can lead to toe fungus and bacterial infections. So you want to reduce the rate of infection. I also want people to be able to understand or to know that they're not supposed to shave before you go to the cosmetologist, because you don't want to cut yourself and open room for an infection or things like that. You want to also make sure that they clean and disinfect. Ask them questions. Don't be afraid, even as clients, to ask questions and make sure that they're doing the right thing. You want to protect yourself. You don't know what the person before brought to the room, and you don't want to carry along with you. And so the last thing also was that I included in their presentation was caring for their equipment and how long they should do it and the guidelines and things like that. So my future endeavors is to keep going on with it, because I feel like this project can be assimilated or can be given to different professionals, not just cosmetologists, so massage therapists and people, other professionals that get to care for people's skin, nails, or anything. So, and I also wanted to go back to those schools and give a talk, and hopefully we hope to send it to a journal. All right. And so those are my references. Do you have any questions?
Any questions?
Yeah.
Did you see if there? Did you see if were there any programs in Indiana or maybe in other states where like they taught people these things because they also recognize the importance of it?
No. So that's what I meant by filling in the gap, because when I was even searching for this information, I had most of what I did, I had to come up with on my own. The only information I could find was like on cancer, and that's general. But then information specific to cosmetologists and healthcare, like non-healthcare providers, but people that care for individuals. I didn't find anything. The only one I found was in Texas, and that was about 10 years ago. Yeah. So, but that's why I thought this would be a great way to kind of spread out this information, disseminate it. Yeah. Yes.
Thank you. Karen, this was great.
Thank you.
A good job on doing your research. I have a question. I have two questions.
All right.
The first one, the one slide that you showed about how many people were diagnosed with cancer.
Yeah.
I'm assuming that's just skin cancer, right? In Indiana, or was that cancer in general?
Cancer in general.
Oh, okay.
Yeah.
So the 13,000 people who the actual death, that's cancer in general, not just not just skin cancer.
No,
okay.
No.
So thank you for that clarification.
Yeah, the reason I included that was because most of the cancer, for you, those ones are malignant, so they spread, they're cancerous. So when you catch it, because most cancer, it might start from like a lymph node or something small, and then it spreads around. So when you hear brain cancer, for instance, it could start from somewhere else. So identifying something on your skin, it's one way you can be proactive. Mm-hmm. Yeah.
Mm-hmm. So that's about maybe a little bit less than half, which is a big number of people that die from it, actually, just in Indiana. My second question is, and I know you concentrated in Fort Wayne on the clients.
Yeah.
But I wonder if this is more of like maybe for the future, if there is also a side of the people, the cosmetologists, that are maybe also getting some of those diseases from interacting with the clients.
Yeah. Mm-hmm.
So I don't know if you came across it, or if you are planning to research that part in the future. Just curious to see that.
I did read something about some of the chemicals that they do come across, and when I gave the food care information then last semester, I talked to them about things they should do. If they feel like it's too strong, they need to wear masks. And most of the time they're supposed to go through OSHA laws. So that's the body that kind of regulates how they care for clients. And so they're supposed to go through that. And I also talked about, I had this whole slide about infection for them and how I told them and I explained to them whatever a person has, they can get it if they're not careful. So yes, but I think it would be great to expand on that because there's so many things that they can get that and how they need to protect themselves. Yeah.
That was a great presentation. I'm curious about, like you're talking about the gap between, you know, what a cosmetologist or a massage therapist might see and then the information they might have. And so you gave presentations at these two beauty schools. How do you think that they could incorporate this kind of information into their curriculum? Is there something beyond just having someone, you know, like you from, you know, a nursing department or something like that come and give a presentation? Or do you think there might be additional ways that they could be more proactive in having their students spot these trouble signs in their clients, but also things that you'd hope like cosmetology boards would be working on already, like infection prevention, and it seems like maybe there's a little gap there as well. So what are some methods you think they could use to improve that?
Yeah, I think that's a great question because I did read their licensing. You know, they have this whole packet about what's their whole, I don't remember the name for it, the board of, I went to check their board of cosmetology and I read it and they didn't have a lot. The only thing they had health-wise was about like care, the sterilization and things like that. So that's a great question. When I spoke to those instructors at this beauty school, one thing they told me was, I told them I was going to provide them this information. I was going to expand on it and give it to them so that way they can include it in their curriculum. So that way they're teaching their students and they have this information. I was also going to make, I don't have it with me, but I took this EKG class in the hospital and they made this little pamphlets. It was a ring binder, but it was like a 4x4. And it had those pictures of everything that you needed to know, quick tips. And I was also going to make that and have it for the students. That way they have it. But I think I haven't seen anything done about that, and that was why we started it. And if my professor was here, she also wanted to see if there was a way nursing students could go, like a semester-based thing, to go talk to students there as well. And that's where that whole collaborative healthcare, that's where the name comes from, where we're collaborating. And my last slideshow talked about that. I didn't talk about it, but where healthcare professionals, not just nurses, not just students, but there's more of a collaboration with people that get to see clients that we might never see, you know. And I like the barbershop talk, I think is something like that. So, yeah, a great question. Yeah.
So thank you so much. I really enjoyed your presentation. I was wondering, you know, I was thinking about the opportunity you had to actually speak with some of the clinicians who do this work. And I wondered, as you were giving, you know, your presentation, if any of them had personal stories about things that may have come up for them, or, and just kind of your general impression of, you know, how receptive they seem to this. Was this something they had thought about, or was it really kind of brand? I mean, obviously from your pretest there was new information there. Yeah. So just to hear a little bit more about their reception to.
Okay. Yeah. So the first school I went to, I also think it depends on the materials I had. The first school I went to, they had a TV, so I could project my presentation through that TV. Now the second one, and that's where that whole barrier thing I have to kind of cross with. So the next time I go for a presentation, I'm gonna take a board with me. So, but the other school, they didn't have those. So, but with them seeing the pictures and everything, they were like, wow, we do see that. We don't know what to do. We usually ask our instructors, and they were relying on experience. So what they've done in the past, or based on what they've done or seen before, or what their colleagues have told them. And that's how they were teaching their students in regards to health problems. And so they were they were excited, or like, you know, grateful to be able to see that, you know, there's a health perspective to those kind of things that you're seeing. And then it's like, almost as if someone comes to you, and you know how they say the customer is always right, and they're like, yeah, cut my nails, and they're diabetic, and you're not supposed to cut their nails, you're supposed to cut it like straight across, and they're diabetic, and you're like, no, I don't think I can. But then, you know, someone wants to pick a fight with you, but then now you have a reason to tell them. So it was more like a relief to the students, at least the first school. The second school, they were glad that they got that information, because some of the things they knew, but now it was more information. They had more things that they knew they could protect themselves from, as well as their client. Yeah. So, yeah.
Thank you, Karen, very much.
Thank you.
you.